Dear students, you are welcome to yet another lecture on gynecology. Today we are looking at investigations and diagnostic procedures in gynecology. My name is Kiden Robin and I will be taking you through this. So when we talk about investigations and diagnostic procedures in gynecology, we all know that gynecological investigations are crucial for diagnosing conditions affecting the female reproductive system. So like we stated previously, this is basically about the female reproductive system. So diagnostic procedures help guide treatment plans and monitor the progression of diseases. These investigations include clinical assessments, laboratory tests, and imaging techniques. So the tools that we use normally, we have a speculum, and this is divided into two Sims and Cascos speculum. The Sims speculum is the one that needs to be held down, whereas the Cascos is self-retaining. We also need the swabs, antiseptic solution, gloves, and the rectal tray. So what are the methods? Well, we have a speculum examination, which is used to visualize cervix and the vaginal walls. Then we have the digital or bimanual examination. This one assesses the uterus, position, size, shape, and mobility. Then we have endoscopy for deeper investigations. Let's start with laboratory tests. Now, under laboratory tests, we have urinalysis. Here, the sample is urine, and the urine is examined for the following: color, odor, protein, glucose, microorganisms, and pregnancy if indicated. But if not indicated, then normally pregnancy can be ruled out. This depends on the age of the woman, whether she is still in the reproductive age or not, and the other factors that can be related to that. Then blood tests. Blood can be tested for hemoglobin levels, full hemogram, widow test, brucellosis, and VDRL. Also, microbial swabs can be taken. Here, urethral smears can be done for Neisseria gonorrhoeae. High vaginal swabs can also be done for Candida albicans and Trichomonas vaginalis. Then endocervical swabs for gonorrhea can also be done. Diagnostic procedures. One, we have dilatation and curettage. So this is a procedure which involves cervical dilatation and endometrial scraping, as you can see in the image. Right there, it shows how it is done, where the uterine curettage is inserted into the uterus and the endometrium is scraped off. Indications. This one is indicated in the endometrial or endocervical tissue sampling for cytology. Like for instance, if a sample is required for cytology, then the endometrium will be scraped to make sure that the sample is got for the investigations. Then control of abnormal uterine bleeding. If there's abnormal uterine bleeding and it could be related to the bleeding from the walls of the uterus, call it the endometrium, then it can also be done. Then therapeutic management of incomplete abortion. If the woman is having pregnancy of less than 28 weeks and she starts bleeding, then the products do not all come out. Normally the dilatation and the curettage is done to make sure that everything is evacuated. Then are usually performed under general anesthesia. Then we look at the cytological tests. Under the cytological tests, we can look at specifically pap smear. So pap smear is a routine examination to detect cervical abnormalities and the follow-up on treatment, on treatment of carcinoma. It is recommended in the following intervals. The first 2 smears can be done 1 year apart, then every after 3 years. So when the person goes for the first pap smear, which in most cases is intended as a follow-up examination on treatment of carcinoma or cancer, also the cancer of the cervix. So when the person goes for the first investigation, then the next should be done after 1 year. Then after that, it can be done every after 3 years if it is not detected. So this is common after the age of 30 or in sexually active women. It's very, very important that the woman can do such kind of investigations, even if the woman is not undergoing any carcinoma treatment, but can be as preventive. Then cervical biopsy. Cervical biopsy is performed without anesthesia and can be guided by colposcope. The post-procedure care, the woman needs rest for 24 hours. She should be monitored the vital signs and also bleeding. Then the woman needs to delay intercourse until cleared by a gynecologist, then she can now resume intercourse. So when we talk about cervical biopsy, a biopsy is like a piece of muscles or a tissue, let me say a tissue, which is required for investigation. So cervical biopsy, this is normally a tissue which is taken around the cervical area. So this tissue is taken for investigation. And because the woman will not actually feel much pain when it's only the discomfort she will feel, there's no requirement for anesthesia during this procedure. Endoscopic examinations, pelvic endoscopy, or we can call it aldoscopy. This one visualizes pelvic organs via an incision in the posterior vaginal fornix, detects pelvic masses, and visualizes reproductive structures. Then another procedure is laparoscopy, diagnoses and treats conditions like tubal ligation, ovarian biopsy, and adhesion lysis. It utilizes carbon dioxide insufflation for better visualization so that everything can be visualized well. Requires general anesthesia and the postoperative observation because it exerts lots of pain and it can involve bleeding. Then hysteroscopy visualizes uterine cavity for conditions like infertility and retained intrauterine devices. It is best performed 5 days after menstruation and is contraindicated in cervical or endometrial carcinoma because it can make it to spread further when it is tampered with. So hysteroscopy involves insertion of a device into the uterus via the cervix, and this enables the person or the doctor to visualize inside, to look and see around in the endometrium. Then radiological investigations. Here we have hysterosalpingogram. This one is an X-ray of the uterus and the fallopian tubes with the contrast medium. So pre-procedure preparation can be enema, fasting, analgesics, and the hydration post-procedure. So before the person is taken for this kind of X-ray where they are going to visualize the uterus and the fallopian tubes, the person needs to first of all fast. It is normally 24-hour fast. Then enema can be given to ensure that the rectum is empty. Then the person is given analgesics, painkillers. Then after that, the person should also be hydrated to ensure that he's having enough fluids and will have energy, given the fact that the person is not eating. CT scan. This detects cancers and retroperitoneal lymph node involvement. Is more effective than ultrasound in certain conditions. That is the CT scan. Then lastly, we are looking at radiological investigations, and under this we have ultrasound. This one is commonly used and it requires a full bladder for optimal visualization, because a full bladder will allow the uterus to be displaced from the pelvic region, and as a result it can be visualized clearly. So that marks the end of our today's lecture, which is about investigations and diagnostic procedures. Thank you.